Did you know that I've only actually ever been in the hospital, I think, twice in my life? The day I was born and then the day I broke my leg. Apart from that, I've never been in the hospital, which is good. I'm in pretty good health. I tend not to get very ill, which is nice. However, there are people out there who do struggle with their health, either physically or mentally. And where do they go to? They go to something called a hospital. And in England, our hospital system is called the NHS, which stands for National Health Service. But there's a problem. A lot of people believe that our whole National Health Service is about to collapse. Now, is this true or is it false? Is it going to collapse or is it going to be fine? Well, in this video, we're going to find out.
Analyzing the news.
So the National Health Service, or the NHS, was developed in the United Kingdom and officially launched on July the 5th, 1948. It was created to provide free healthcare at the point of use, and it was funded through taxation. In other words, it ain't free, you're bloody paying for it. Now, the NHS was established based on the principles of universal healthcare. It was spearheaded by a guy called Aneurin Bevan, and he was the Minister of the Health at the time in the UK. Now, if you're from England or the United Kingdom, then you'll be aware of the NHS. But there's been some problems and not a lot of people are very happy about it. So the NHS faces several major challenges, and here are 5 of the biggest concerns that are on people's minds. One of them is waiting times. Many patients experience delays for their GP appointments, specialists and referrals, and surgeries due to a high demand and staff shortages. Now, if we look at the staff shortages, there is a lack of doctors, nurses, healthcare workers, and this is leading to them being overworked staff, and usually what tends to happen is to get very burned out. So that means that recruitment and retention are always going to be like these ongoing struggles. If we talk about things like funding and budget pressures, the NHS is under financial strain with rising costs from the aging population, because people are living longer, aren't they? These expensive treatments and funding and budget pressures. You see, the NHS and the financial strain with rising costs from aging population, because people are getting older, these treatments become very expensive, and there is not enough money, and there's insufficient amount of government spending that's being invested into the NHS. This causes overcrowded hospitals, which often operate at above capacity. That means they're basically full, leading to bed shortages, long AE waiting times. AE stands for accident and emergency, and there's difficulties with just general patient care. You've got to understand that mental health services are being underfunded. There's not enough money going in the hospital to cater for these people's needs that they desperately need. This is the health. Nothing's more important than your health. Now, mental health care receives less funding and resources compared to physical health. Mental health is on the rise, leading to long waiting lists and limited access to any sort of treatment. And if you don't know what mental health is, it's the way you think, because the way you think affects the way you feel affects the way you behave. Now, there is good news. Listen, there is solutions to address these major concerns with the NHS, like reducing long waiting times, maybe addressing staffing shortages, or improving working conditions to reduce burnout and job dissatisfaction. Do you think that They need to increase the government investment to ensure the NHS can meet growing demand, because I bloody do. It's not rocket science, come on. They need to reduce wasteful spending and encourage partnerships with private healthcare providers to ease the burden of the NHS. But they won't do it. They won't do it. But remember this, that the government should be managing overcrowded hospitals and A&E departments and strengthening primary care services so patients can get the treatment from their GPs before the conditions worsen. You got to remember this, the NHS isn't free, you're paying for it through all the taxes that you pay. And here's another one to remember. Remember this, that the government is run by people and these people get paid a lot of money. And if you live in the UK, then you're paying for it. Now, you've got to be consciously aware that it's not the fault of the staff that work in these hospitals. They don't make the decisions of the government. The government make it. The people at the hospital, their only intention is to help people. That's why they chose this profession, the care industry, to help people. They deserve a bloody medal. Now, well, here is the sad part of all this. Did you know that 1 in 7 NHS staff, which is 14.38%, experience physical violence from patients, their relatives or other members of the public back in 2024? And this was according to the latest annual, which basically means this is what happened last year. And this violence towards staff members is increasing. It's not getting better, it's getting bloody worse. They're not there to take abuse of people, they're there to help people. But unfortunately, that's the world we live in. You see, doctors and nurses and staff are here to help people, not be insulted or assaulted by them. But again, unfortunately, some people are a pain in the neck. Some people, I'm going to choose my words carefully. But most people aren't like that. Most people are decent, law-abiding, respectful, grateful human beings. Now imagine you're in serious ill health with some sort of life-threatening symptoms. This doesn't guarantee that you're going to be seen immediately by the NHS, and this is due to severe staff shortages. It's often impossible to receive urgent care right away. This is a critical issue because delays like these are literally costing people's lives. Now, if you're listening to this, you think, well, it doesn't affect me. But if you find someone in your life or in your family and they need immediate medical care and they're not getting it and it costs them their life, this video will take on a significant new meaning. You'll be affected by it because now you'll realise that we've got a big problem in the UK. It looks like it's all coming down.
It is a deadly disease and there is no known cure. The virus can be passed during sexual intercourse with an infected person. Anyone can get it, man or woman. So far it's been confined to small groups, but it's spreading. So protect yourself. And read this leaflet when it arrives. If you ignore AIDS, it could be the death of you. So don't die of ignorance.
I was only a child when I first saw that advert and it first come out on the telly. I remember watching cartoons. I was a little boy. I was watching it on the TV back in the old 80s, and then I was exposed to that advert. What are they trying to do? Were they trying to frighten us, terrify us? I was a kid. They shouldn't have adverts like that on at 2 o'clock in the afternoon, because that's when it was on. As soon as I finished school, sat down, watched cartoons, and the adverts come on, and that was the advert I saw. Wasn't very entertained by it. In fact, it bloody traumatized me. See, I can't even get my words out.
Inside the Royal Blackburn Hospital, the BBC was given unrestricted access to witness the pressures facing the NHS.
There'll be patients here for 6 and 8 hours. Can't find a bed for them.
Queuing for 5 hours in the corridor. It's not what you expect for a country like ours, is it really?
We need to get some blood from you.
What's it like here when it's busy?
Dangerous. Yeah. It's frightening.
Are you able to run a blood gas?
Sunday night, a peak time in this A&E. 95 patients and just 33 cubicles and rooms, the sickest are seen first.
We actually have corridor nurses now as well, which shows times are very desperate.
People believe that the NHS is at risk of collapse due to a combination of severe challenges that make it increasingly difficult to provide quality care. Here are the key reasons why. Number one, chronic underfunding. This means that the government are spending less money and they're not keeping up with the rise in healthcare demands, leading to shortages of staff, equipment and hospital capability. Then there's another one. Two, again, severe staffing crisis. There are not enough doctors or nurses or healthcare workers that meet the patient's needs. Many staff are kind of overworked, leading to something called burnout and possibly resignations. In other words, they can't do the job because it's too much. And it is. And then there's number three, which is overwhelmed emergency services. A&E, accident and emergency departments, they're overcrowded and ambulances are facing long delays and patients often wait for several hours, and I mean hours, even days for urgent treatment, putting lives at risk. And then you've got number four, again, which is long waiting times for treatment. Patients often wait months or even years for surgeries, and there's specialist appointments and mental health support leading to worsening health conditions because they're not being seen immediately. Because it's being put on the burner, the conditions getting worse. With that, you've got something which is called winter pressure, and the pressures of winter or seasonal crisis, because every winter we have flu outbreaks and increased hospital administrations, which push the NHS to the breaking point. And that's literally highlighting its fragility and how sensitive it is, because over the winter, a lot of, especially older people, get really sick. What happens then? They go to hospital, the hospital's full. There ain't enough room. That means if you're in dire straits and you need help, you ain't getting it. Now, many people argue that without urgent reforms such as better funding, improved working conditions and more investment in their infrastructure, the NHS may become unsustainable. Do you think the government is going to do enough, or are they doing enough to address these issues? No, they're not. It's not like they haven't got the money. They've got plenty of money.
Analyzing the news.